In this third and last part of the lesson, identifying and addressing maternal and child health risks, we will start with policy frameworks and best practice guidelines for maternal and child health. MCH care. Then we will make a summary with clear method, a unified approach combining robust policy frameworks with evidence-based best practices, is essential for advancing maternal and child health outcomes nationwide. A robust set of policy frameworks and initiatives forms the backbone of efforts to improve maternal and child health MCH outcomes across the United States. At the federal level, the Title V MCH block grant serves as a foundational funding mechanism, supporting critical functions such as care coordination, home visiting programs, and workforce development to strengthen the capacity of states and communities to meet the needs of mothers and children. Complementing this, Medicaid expansion has significantly broadened access to care by extending postpartum coverage and enabling more comprehensive care coordination for vulnerable populations who might otherwise face gaps in coverage during the critical period following childbirth. Perinatal quality collaboratives play an equally important role by driving the adoption of evidence-based clinical practices across birthing facilities and health systems. While the CMS Maternity Core set establishes a standardized framework of national performance measures that enables consistent tracking and accountability of MCH care quality nationwide. Undergirding these policy structures, best practice guidelines call for a holistic approach that integrates clinical, behavioral, and social services to address the full spectrum of factors influencing maternal and child health, while relying on evidence-based protocols and continuous quality improvement to ensure that care delivery remains both effective and responsive to emerging evidence. These guidelines further emphasize the importance of culturally competent, patient-centered care that respects the diverse backgrounds and lived experiences of families, robust referral systems and care coordination that connect patients seamlessly across providers and settings, sustained investment in workforce development and meaningful community engagement to build local capacity, and rigorous monitoring and evaluation of program effectiveness to drive ongoing and improvement. Let's make a recap with our super engaging training method. Nurses must integrate data analysis, validated screening, and evidence-based interventions to effectively identify and address maternal and child health risks, improving outcomes through both direct care and community-level action. Let's make the scenario. Setting: a community health clinic in an underserved urban neighborhood. Composite patient Maria, a 27-year-old Latina woman, is followed from her first prenatal visit through the postpartum period and into her infant's early health follow-up. Maria faces multiple risk factors across the maternal and child health MH spectrum. Let's start with the letter C, meaning connect. Activate prior knowledge and establish real-world relevant scenario introduction. Maria, newly pregnant, visits the clinic for her first prenatal appointment. She lives in a food-insecure household, works 2 jobs, and has limited English proficiency. The clinic serves a diverse, low-income population with high rates of chronic disease and limited access to specialty care. Discussion prompts: what MCH risks are common in underserved communities like Maria's? How might social determinants, e.g. SS, environment, literacy, impact Maria's pregnancy and her child's health? Share experiences where social or economic factors influenced patient outcomes. The second letter of CLEAR method is L. Link bridge foundational concepts to validated screening tools scenario progression. The nurse reviews Maria's history and introduces the use of validated screening tools to assess her risks. Screening tools play a critical role in identifying and addressing maternal and child health risks. For prenatal antenatal care, tools like CBC, BMI, BP, R4U, and PROPERE are used to assess anemia, obesity, hypertension, and social determinants of health (STO), ensuring early detection of high-risk pregnancies. In the postpartum period, the Edinburgh Postnatal Depression Scale (EPDs) is widely recommended for screening maternal mental health, facilitating early intervention for depression and anxiety. For child health, tools such as the Ages and Stages Questionnaire, ASCU, APGAR scores, and growth charts are essential for monitoring developmental milestones and nutritional status, enabling timely referrals and interventions. Additionally, South Dakota O screening tools like PROPERE and Thrive help identify barriers to care, such as food insecurity and health literacy, which impact maternal and child outcomes. These tools collectively guide evidence-based care and improve health outcomes for mothers and children. Time for discussion. Why is it important to use validated tools like PROPERE and EPDs? How do these tools help nurses identify both clinical and social risks?